think it's 12. Hello. Hello. Hi. Good afternoon, everybody. My name is Dr. Nitin Butala. I'm a neurologist and neurophysiologist with Baptist Neurology, Jacksonville, Florida. Um, I think we can wait for a few minutes for other people to join, and let's see. So I'll be here. I'm just waiting for somebody to respond. I think we can wait for a few couple of more minutes to see if other people want to join, and then I will start. Thank you for your patience. Okay, I got a green light to go ahead. So, my name is Dr. Nitin Butala. I'm with Baptist Neurology. I'm a neurologist and neurophysiologist, and my office is at Baptist downtown. Today we are going to talk about. It's a very simple general topic. It's a very interesting and educational topic. We're going to talk about um, when to see a neurologist, and so. Some of you might already know what a neurologist does, but some people may not know. So, neurologist is a subspecialist in medicine who predominantly deals with disorders or problems or symptoms associated with nervous system, central nervous system, and peripheral nervous system, which means your brain, your spinal cord, brainstem, nerve roots, nerves, muscles. Usually, you'll see your primary care doctor first, and then you're gonna get a referral to see a neurologist depending on the need. For the sake of this discussion, we're gonna talk about mostly outpatient neurology symptoms and evaluations. I mean, most of you are aware. I think we have done a good job about awareness of stroke and neurological emergency symptoms and how to go to the ER and when to call 911. So we are not going to talk about like acute or stroke symptoms. We are already well aware of those. However, some of you are not sure when to see and why to see a neurologist. So that's where we're gonna focus our discussion on. So to begin with, most importantly, what are some of the things which neurologists can help you with? So all of us have five senses: hearing, vision, smell, taste, and sensations on our arms and legs. So if you're having any trouble, like say vision problems, hearing problems, problems with smell, problems with taste, or problems with sensations of arms and legs, tingling, numbness, those are really important reasons to see a neurologist. Now, not every time these problems means that you have neurological problems, but or neurological disorder, but it's always better to get an opinion. And of course, your primary doctor will do some tests to rule out other conditions or primary eye conditions, primary ear conditions, primary ear, nose, throat conditions before sending you to a neurologist for abnormal sensations, like say vision problems, hearing loss, or smell problems. So, there are some neurological disorders who do present with changes in the vision. For example, optic neuritis, multiple sclerosis. Sometimes there are disorders associated with increased pressure of the cerebrospinal fluid, and that can also cause you to have vision symptoms. Similarly, hearing issues, hearing symptoms or hearing problems could be indicative of underlying neurological disorders such as schwannoma or a brainstem tumor. Not everybody has it, but again, your primary doctor, if they feel it's important for you to see a neurologist, they will give you a referral for that. Smell, allergies can affect your smell, but sometimes you could have underlying neurological disorder. For example, Parkinson's disease, there is an association of loss of smell and Parkinson's disease. Some patients do have noticed that as a symptom. Same thing, taste sensation. You can have neurological disorders manifesting with loss of taste, and probably more commonly, we see patients with tingling, numbness in their arms and legs. Those are some of the more common bread and butter neurological consultation reasons. Patients will complain that they're having tingling, numbness in their hands or legs, sometimes the whole body, sometimes the face. So those are really important reasons. Again, they can indicate some of the underlying neurological conditions, or it could be a manifestation of systemic disease, something as simple as vitamin B12 deficiency, but a lot of patients don't know about it. So let's move on to some of the other reasons why you should see a neurologist. Now, headache. Headache is a really common reason to see a neurologist, and your primary doctor might be helping you with that. But sometimes, in spite of doing all the necessary things, your headaches are not under control, and that's when a neurologist can help you. The neurologist will take a detailed history of your headaches, where it starts, how it spreads, is it unilateral, is it bilateral, what triggers it, what makes it better, what makes it worse, whether you have any other neurological symptoms associated with your headaches, your frequency. Those kind of symptoms help to classify and define a type of headaches, and it also helps us to decide whether you just need symptomatic treatment versus you need some neurological workup like imaging and things like that. A neurologist can definitely help you that. A neurologist can also help you to understand the difference between migraine headaches, cluster headaches, or tension headaches. Neurologist can help you with understanding the triggers of the migraine and of course treatments. Now, moving on to the next topic, a lot of patients are suffering from chronic pain. It could be a neck pain, it could be a back pain, and it's an important reason, especially if you already have seen other specialists and you have not had answers. Sometimes A neurologist can help you to find those answers. Sometimes getting a referral for physical therapy is as good as medication treatments for some of these chronic pain conditions. And if you need any neurological workup, like MRI or exercises, the neurologist can help you guide that. And a lot of times, patients may have had previous accidents, injuries, and they manifest with these residual symptoms of pain, which might help which might be helped by seeing a neurologist who can definitely help them with symptomatic options. Now, some of the other, reasons could be something like dizziness. Now, dizziness is a very non-specific symptom. It could be because of multiple reasons why you could have dizziness, and a neurologist can help you understand what is the origin of your dizziness. And again, neurologist will examine you. They will ask you more questions and decide whether your dizziness is coming from brain or CNS etiologies, or it's coming from peripheral etiologies, whether it's a side effect of your medication, whether it's something which you're not doing versus you're doing, or it could be a manifestation of underlying inner ear disorders or vision issues. So a neurologist can definitely help you for that. A lot of patients actually do suffer from chronic dizziness or lightheadedness. They will describe it in a multiple ways. Like sometimes they will describe it as a room spinning sensation. They will describe it as lightheadedness. They will describe it as a sense of imbalance. So, our eyes, our ears, and our nerves in our body, they actually work as a team, and they send a signal to your brain in order to make the brain aware of your position in the space. If one of them is not working fine, you can have dizziness as a symptom manifestation. Of course, you have to also look at your heart and other, your medication. Sometimes dizziness is a very common side effect of many of the medications. So that's where the neurologist can help you. Now, if you have weakness symptoms, like sometimes patients may not specifically have an underlying neurological disorder. Of course, it's when you have a known neurological conditions, say like stroke, epilepsy, multiple sclerosis, you're more likely to be already under the care of neurologist. But a lot of times patients get admitted or patient gets seen for different reasons, and they're still not getting answers. So sometimes that may not be a bad idea to seek answers from by seeing a neurologist. Like patients get seen or they get admitted, like for example confusion or changes in the mental status. A lot of times they get admitted for these reasons. They get neurological workup, but sometimes they still have some unanswered questions, and that's where you can see a neurologist as an outpatient to get those answers. Weakness, as I was telling, you can have generalized weakness, you can have a localized weakness, you can have weakness from systemic disorders, you can have weakness because of specific neurological conditions, and neurologists can definitely help you to further manage these symptoms or develop a plan on how to treat these symptoms. Coming back to some of the other neurological conditions or symptoms, tremors, movement disorders, gait dysfunction. It's very important to seek neurologist's opinion if you're having some of these symptoms, because they could be a sign of underlying neurological disorder. A neurologist will help you to rule out or rule in some of these conditions, or reassure you or your family members. A lot of times patients actually get seen by, they meet their family members or friend after a gap of few months or few years, and they might get worried about their loved ones, and they will be like, oh yeah, so and so told me that you should see a neurologist, I saw your hand shaking, oh, you're not walking right. So or sometimes patients get told by their other doctors, physical therapist, that hey, why don't you get it checked with a neurologist? So Those are some of the important reasons why you should see a neurologist. Seizures or epilepsy, it's a very well-known neurological conditions, and definitely we are all aware of that, and it's an important reason why you should see a neurologist. But now sometimes if you have a well-defined epilepsy syndrome, okay, you know the diagnosis, but many times patients may not present you, or patient may not know to see a neurologist. Like they might be having just periodically this weird neurological symptoms, but nobody has given them the diagnosis, or they are not sure about the diagnosis. Recurrent spells of loss of consciousness, recurrent spells of altered mentation, sometimes just shaking or twitching for maybe a second or less than second, which people may not think that, oh, it's nothing, it just. But it's important to discuss that with your doctor, and your doctor might refer you to see a neurologist. And we have now a lot of newer generation medications which are available to control the seizures. Now, demyelinating disorders, abnormal scans, patients get workup for a variety of conditions. Sometimes their other doctors will order some neurological tests, like such as MRI brain, and they may see some spots here and there, and patients are not sure what to interpret of that, and that will be a good reason, to see a neurologist. Neurologist will take a careful history and decide whether this is something non-specific, as we refer to it as a non-ischemic white matter disease, versus it's a demyelinating disorder such as multiple sclerosis, and will guide your care in an appropriate direction. Oh, by the way, if you guys have any questions, feel free to write in the messages, or let me know, and I will address these questions one by one. But feel free to type your questions, whatever comes to your mind. The other, we talked about headaches, we talked about pain, we talked about strokes, epilepsy, weakness, gait problems. The other important thing, which a lot of times patients don't think it's important, is sleep issues. Nobody usually goes to see a doctor because they are having sleep issues. They usually will go to a doctor for some other reasons, like uncontrolled headaches, changes in their memory, changes in mood, behavior, jitteriness, lack of concentration. So it's important to take a history about or to know about your sleep patterns, and it could be a manifestation of underlying sleep disorder, like obstructive sleep apnea, and there are some other really fascinating neurological sleep conditions which are treatable actually. So, but again, if your sleep is like in the way I educate my patients is like sleep serves the same purpose as like at the end of the day, like how we shut down our computers and reboot them so that they are ready for the next day. The same thing the sleep does to the body. Like when you get a good, perfect, peaceful night's sleep, your body actually kind of maintains the necessary process, and it's kind of restores the process, restores the memory, and the muscles, and they all get rest, and you're ready for the next day. But if in general our body can handle lack of sleep for 1 day, 2 day here and there, but if it's happening every day, if you're not getting a restorative sleep because of XYZ condition, then you are going to have a variety of neurological symptoms. Some of the common symptoms is like early morning headaches. Sometimes you can have jitteriness, anxiety, sometimes non-specific aches and pain, sometimes changes in the memory. So it's important to seek medical attention about these issues. A lot of times, excuse me, just get a water. A lot of time, patients have sudden loss of consciousness or sudden changes in their memory or mentation, so those could be very well side effects of medication, versus it could be some underlying neurological process, and most of the patients will seek opinion from a neurologist about that. In summary, I just wanted to make you aware that a neurologist can help you in a variety of ways, and we treat a broad spectrum medical conditions. We do have further subspecialization, especially with Baptist Neurology. We have so many different type of specialists. We have people specialized in neuro-ophthalmology. We have people specialized in epilepsy. We have people specialized in neuromuscular disorder, movement disorder, stroke, neurocritical care. So those are all sub-branches of neurology, and we just wanted to make sure that patients are aware, and just wanted to help you guys. So thank you very much, and I'm here if you guys have any questions, or if you didn't understand something which I said, or I'll be more than happy to discuss that further. One thing actually I want to add is that and it's totally okay to see a neurologist, even though you don't have like a dedicated or like a diagnosis for neurological conditions. If you just have a question in your mind, whether this could be, it's just for your peace of mind. I read this in a lot of people. They read something on the Facebook or internet or Google, and they get worried or anxious about certain things. And it's totally fine to see a neurologist there to discuss, if you have any neurological symptoms, or if there is a family history of something. Oh, so and so in my family had this disease, so so it's totally fine to come to us and discuss that. There are a lot of, actually, like for example, aneurysm. If you have family members with history of cerebral aneurysms, and if you have more than one family member with history, like directly related to you, with history of family aneurysm, like let's say like for example, if somebody has mom and dad with aneurysm, so they are like two first-degree relatives. So those people are at higher risk of having aneurysm themselves. So they need a periodic screening. So we have recommendations for some of these neurological conditions which could be hereditary and could be passed from one generation to the other. And it doesn't hurt to get opinion or discuss this, even though you're not having any active symptoms. It's definitely important to speak about it with your doctors. Most of the times the primary doctor will send you to see a neurologist once they review your family history and other stuff. So I just remembered that. Feel free to write questions or all right. Well, I assume that we don't have any more questions. So, anyways, as I said, my name is Dr. Nitin Butala. I'm with Baptist Neurology. You should be able to find us on Baptist Neurology website. And if there is anything else or any other questions comes after this session is done, please feel free to contact us or our team, and I'll be happy to answer those questions. Thank you very much for your time, and You have a good rest of the day. Okay, bye.